behavioral therapy. And so let's go ahead and jump into it then. So, first, as you can see on the screen up here, oh, you can't see on the screen because I'm on the wrong slide. That would be helpful. Okay, what is cognitive behavioral therapy? Before I dive into this, I kind of want to talk about therapy in general. Every time I talk to somebody about therapy, I get this kind of misconception about it. People think like, well, isn't therapy just talking to a therapist and she like tells you like how you're like the precious little angel and everybody's beating up on you and your dad's an alcoholic and stuff. And it's like, well, no, like it isn't just you going to therapy and crying to somebody and then patting you on your poo poo and saying, oh, you're such a good little boy or girl and the world is against you and you're right in everything you do. Like, therapy does have benefits. I mean, therapy can be that way. It can, you got to search around for a good therapist because it can be like somebody who just tells you what you want to hear for $140 an hour. And sometimes that can be beneficial. Sometimes it can be nice to just have somebody listen to you. But cognitive behavioral therapy has a purpose, it has a genuine goal in mind. And it is not, it's about as far from telling you what you want to hear as it can possibly get. So I kind of wanted to break that misconception at first. A lot of people think somebody goes to therapy, they're just walking into a room to piss and moan and cry to a stranger about their problems. And you do piss and moan and cry a lot in therapy. There's a lot of crying, there's a lot of pissing and moaning, but you're also working through issues that you have based on things that have happened in your past. I got to get used to using that mute button when I burp, get all the human noises out of the room. I'm still not there yet, working on it. But it isn't just that. There's a lot more that goes into it, and it is very helpful. The most helpful form of therapy that I found is cognitive behavioral therapy. And so, yes, I have done cognitive behavioral therapy. I did it for roughly 2, 3 years with a therapist and continued doing it by myself, kind of working on habits I needed to build that I learned about, that I learned I needed to build in cognitive behavioral therapy on my own. And I did that for about another 3 years after doing about 2 or 3 years with a therapist. And it was expensive. It was expensive. That's something you do need to know about a good therapist. You do want to shop around for a good therapist. We'll talk about that a little later in the stream. But it is expensive, but it is worth it. I did it, like I said, and it helped me out a lot in life. So when I did cognitive behavioral therapy, I was kind of like at a point in life, I don't want to dive too deep into it, especially on like first stream getting like super serious. But, I was at a low point in my life where it was kind of like when shit rains, it pours kind of situation, whole bunch of bad doo doo in my life, and needed needed to find some way to fix it. And every method that I had used up till about 28, 29 years old wasn't very effective because life just kept getting shittier. And I had finally come around to the idea that maybe it's me. Maybe I just fucking suck. And that's why my life fucking sucks because I'm doing things wrong. But I didn't know what things I was doing wrong. As far as I was concerned, I was trying to do everything right. I was trying. I didn't do everything everybody said, okay, but people tell you to do a lot of shit in life and you can't do everything everybody says. I was at least trying to do the right thing on a pretty regular basis and either failing at it or I would do it and it wouldn't work and nothing good would come of it. So I settled on the idea that I probably need to go talk to somebody who might actually be able to give me decent advice. And after doing some research, what I landed on was a therapist. And I went and saw a whole bunch of therapists until I found one that I liked, that I gelled with, that was really cool. And she introduced me to the concept of cognitive behavioral therapy, or CBT is what they call it. And after 2 or 3 years of doing it, it helped out a lot. It changed a lot in my life. I was able to curb a whole lot of addictions that I had up to that point. I was able to completely reframe a lot of the bad things that were happening in my life so that instead of feeling all sad and poopy in my pants about it, I felt really good about it. I felt like, oh, wow, these bad things happened, but a lot of other doors opened and now I have a lot of other opportunities. It really opened my eyes to the idea that just because bad shit happens in life, that doesn't mean your life is bad. There's a silver lining to every cloud, right? Now we're getting a crackle. Think that was the mic cable. Okay. More technical difficulties. Thank God they're all easy today, though, right? All right. So, anyways, that's how cognitive behavioral therapy helped me. It really helped me. It helped me change from a very person with low discipline, an undisciplined person, to somebody with a lot more discipline who's able to pick a goal, work towards that goal, and achieve something in it. Something that achieve something that I'm proud of. And that's worked out multiple times in my life since then. So I highly recommend cognitive behavioral therapy. I've shared it with all my friends and family, everybody that I know, especially if I know somebody who can use some help. I always point them towards the direction of cognitive behavioral therapy. And I think I got a couple friends now that have at least tried it or are currently in it. So, and I'll have to maybe one day later on a mental health Monday, we can get one of those guys in and they can tell you how it's going for them. That would be kind of cool. But in the meantime, let's go ahead and dive into the topic. Okay, what is cognitive behavioral therapy? Well, that's what we have right now. Cognitive behavioral therapy, CBT, is a structured, goal-oriented type of psychotherapy. Psychotherapy is talk therapy. Mental health professionals, including psychologists, therapists, and counselors, use it to treat or manage mental health conditions and emotional concerns. It's one of the most common and most studied forms of psychotherapy. It's the best studied forms of psychotherapy. CBT is based on several core principles, including 1, psychological issues are partly based on problematic or unhelpful patterns of thinking. That's an important one. You don't realize how many patterns of thought that you have are based in a cognitive bias, are unrealistic, or just plain ass negative. You're just a fucking negative Nancy, bro, and you're not helping nobody, least of all yourself. Point number 2, psychological issues are partly based on learned patterns of unhelpful behavior. The term for that is maladaptive behaviors. It sounds really nasty, like you're just a maladaptive person. You should just go fuck off somewhere with your maladaptiveness. Don't bring it around me. But that's not really the case. Maladaptive behaviors developed in childhood. Think when you're a child, you're like a computer, right? And you don't even have operating software. You're just a computer, you're just a hard drive, you're completely raw. And the first few years of your life, you're creating an operating software, right? Windows, Mac, Linux, whatever. You are building up the operating software, and what kind of operating software you build up in your life is going to dictate what the rest of the programs are that you can run on this system of yours later in life, and how good you're going to be able to run those programs, how effective they're going to be when you run them. And so if you think of it like that, it's very, very easy as a kid when you're building this operating software. It's coming from everywhere. It's coming from your parents. It's coming from your teachers. It's coming from friends at school. You are seeing how people act and developing this idea in your head of, oh, okay, this is how I'm supposed to act. This is how life works. And then you're doing a lot of experimenting as a kid. People don't realize how much kids actually experiment or employ, in a really funny way, the scientific process. But they actually are, right? You think a 2-year-old is, smart enough to know what a scientific process is. He can't even pronounce the fucking word, right? Well, the scientific process, you start it right from the get-go, man. You analyze how other people act, you analyze what's going on in life, and your brain tries to figure out a solution to whatever problem you're experimenting. Think of like a 5-year-old in a grocery store wants his favorite brand of cereal, and his mom won't let him get it. And his mind's, and everybody's seen this. We've all seen this play out in a grocery store at some point, or if you haven't, it's become a common trope at this point. 5-year-old decides that the way to solve this issue is to jump on the ground, kick his little feetsies, scream and cry and pout and yell at the top of his lungs, and see if mom gives him the cereal. If mom gives him the cereal, that goes into his operating software. He knows now, oh, if I bitch and scream and cry and pout and kick my little feetsies, I get what I want in life. And if his mom says, no, little shit, little Tommy, you asshole, go ahead and kick and scream. You're not getting your cereal. And if you scream loud enough, I'm not going to give it to you next time neither. And little Tommy says, oh, shit, I better shut the fuck up. And he learns, his operating software clicks and says, okay, if we bitch and scream and cry and moan, we don't get what we want. In fact, the situation gets even worse. And that goes into his operating software. And that's how he continues to live his life from that point forward, right? You're doing this when you're a little kid. Well, it's very easy for you to end up being that kid that learns to kick and scream to get what he wants. And that might work when you're a child. When you're a child and it's just your parents who are giving you what you want, you are completely 100% dependent on them. And that might work. But then when you turn 18, 20, 25, 30, and you got a wife or a husband, a girlfriend, a boyfriend, you got friends, you got a boss, and none of these people are here exclusively for you. They're here for them. They're here to help themselves out. And they want you to be a part of their life. Well, that kind of behavior doesn't fly most of the time. 90% of the time with most people, you throwing a fit, kicking and screaming because you didn't get what you want is not going to help you build high quality relationships in your life. Most logical people are going to be like, Jesus Christ, Tommy's a fucking dick. Like, I don't like this guy. He's a little fucking crybaby. And you're going to push people away by doing that. This is now a maladaptive behavior. It was a behavior that worked for you at one point in your life. So you learned it and employed it and got what you wanted. And now you're older. It doesn't work no more. And in fact, it's fucking your life up. So that is a maladaptive behavior in a nutshell. Going on to point 3, psychological issues are partly based on problematic core beliefs, including central ideas about yourself and the world. So yeah, this is, again, kind of works with point number 1, unhelpful patterns of thinking, problematic core beliefs. This can be beliefs like I'm not good at anything, working doesn't mean anything was a belief that I had at some point in my life. I had come to the conclusion through years of trying and failing at things that it doesn't matter how hard you work in anything in life, nothing's going to work out. That's a very negative idea to have about life, right? And it's a problematic core belief that becomes a part of your operating software. And what do you think happens when you think that way? You stop working towards shit. You stop caring. You decide, well, what's the point of making any effort in life, right? There is no point because nothing's going to work out. You got to get rid of those core beliefs. CBT helps you with that. Point number 4, people experiencing psychological issues can learn better ways of coping with them. This can help relieve their symptoms and improve their mental and emotional health. So all those issues that you have in life could potentially be based off of unhelpful patterns of thinking, unhelpful patterns of behavior, which would be maladaptive behaviors, problematic core beliefs and central ideas about yourself and the world. And all of these issues can be solved. You can figure out a better way to do this. You can get rid of these core beliefs, unhelpful behaviors and patterns of thought with simple practice. And those are the general ideas of CBT. And those are very, very powerful ideas. Okay, continuing. During CBT, a mental health professional helps you take a close look at your thoughts and emotions. This is where the crying and bitching comes into play. You'll come to understand how your thoughts affect your actions. Through CBT, you can unlearn negative thoughts and behaviors and learn to adopt healthier thinking patterns and habits. CBT usually takes place over a limited number of sessions using a question and answer format. Your therapist helps you gain a different perspective. As a result, you learn to respond better to stress, pain, and difficult situations. CBT can be used alone or along with medications and other therapies. This is an important point that we'll go over later on. Your therapist will customize your treatment based on the issue you're addressing. I caught that nasty human noise with the mute button right there. Got it. We're learning. We're getting there. So, okay, that's what CBT is. CBT is a way for you to analyze the way you think, the core beliefs you have, and your actions, your behaviors, and figure out which ones suck and which ones don't. Which ones are going to help you in life and which ones are not helping you in life. And then figure out a way to replace them with more positive core beliefs, patterns of thought and behaviors, right? Okay, so that's what it is. Did I need this web page for anything else? How can I find a therapist? Yada, yada, yada. That's procedure, risk, and benefits. Okay, we'll save this just in case. I didn't give myself enough time to go over these completely. I'll do that in the future. Another burp. All right, continuing. So, how does it work? How does CBT work? Okay. Some forms of psychotherapy focus on looking into the past to understand current feelings. Instead, CBT focuses on present thoughts and beliefs. It emphasizes the need to identify, challenge, and change how a person views a particular situation. It does go over some of your past issues. There's that burp. It does help you go over some past issues that you've had in your life to address where some of these uh, maladaptive behaviors or patterns of thought might have come from. But generally, it's meant to focus on what's happening right now in your life and how you are approaching it from a negative aspect, whether that's a behavior that you're introducing to it that's making it worse, or a pattern of thought that is coloring the situation to make it seem worse than it really is, right? Okay. Although counselors typically personalize sessions to an individual, CBT steps may include an, an individual assessment. That's a pretty regular one. You're always going to have that. Establishing goals and areas to work on early in the process. Regularly checking the person's mood and any life updates. Collaboratively setting agendas for each session. Reviewing any homework. Punctuating discussions with feedback and summaries. Assigning further homework at the end of sessions. So, changing distortions and perceptions. So this is generally the crux of what CBT does. This is some things you're going to go through or may not go through in a traditional CBT therapy session. You know, like as far as like homework, nobody likes that word. That makes it sound like, oh my God, I got to do shit outside of it now. Fuck this. Um, I actually ended up doing a lot of homework once I got into it and I discovered how helpful it was. I ended up reading books on it, a lot of books on it, and ended up doing so much homework in my spare time that I could come to my therapy session, come to my therapist and say, hey, I read about this kind of technique or this kind of exposure therapy. Is this something that we could use that could help me? And she was like, oh, wow. Yeah. Look at you, fucking overachiever from once in your life. And so, you don't have to do, homework in general is going to be, in my experience, was pretty minimal. It was mostly stuff like, why don't you go home and maybe think about how this thought process that you have has messed up certain things that happened in your past, in your life, right? And so you'll go home and you'll kind of begrudgingly think about it and you'll realize, oh, wow, that thought process fucked up a lot of shit. It'll be stuff like that. It's not like, now go home and do these 20 math questions. So one good thing that I like about CBT that I think is important for a lot of people, because it is very surprising how many people I run into, and surprising for myself actually at a young age. I never really learned how to have a goal orientated mindset, how to like create a goal and then create steps to making that goal happen, and then checking those steps off one at a time. And that wasn't something that, they don't generally teach you that in school to be, you could kind of be like, well, maybe in this or that, but they don't just flat ass put it in front of you and say, hey, fuckhead, this is how you achieve a goal in life. And some of us need that. Some of us need, to be shown this is how achieving a goal works. And a lot of people do. And so I'm very surprised by how many people I meet, or maybe I shouldn't be, but I'm still surprised nowadays by how many people I meet that don't have that goal-oriented mindset. They don't know what that even means. They don't know what the process of writing down a goal is. And, I used to be that way. And now you can ask my girlfriend, my cutie pie. I got lists. I actually have one right here. I just printed off my goals for this month. You can't read it, but yeah, I have this monthly goal list for different areas in my life, working out what my goal is for this month, what I'm going to achieve. Writing, I'm a writer, what I'm going to achieve this month in my writing, what I'm going to achieve with my investment accounts this month, what I'm going to achieve with my home. I just bought a new house, so there's a lot of goals there. And then what I'm going to achieve with my streaming. I have a goal every single month. I print out a new sheet, and when necessary, we'll fill that sheet with the steps needed to achieve that goal. What are the time frames? How, like just take one of these, for example, in writing, I'm going to write 5 short horror stories this month. Okay. So it'll be pretty regular for me to get a general word count. I want each story to be around this many words. I can write this many words in about this many days. Give 1-2 days for leeway. Each story should take this many days. I should have this many stories by the end of the first week of the month, second week of the month, third week, yeah, so on and so forth. And so I have time limits on each step of my goal. And that whole process of figuring all that out, I do that. And a lot of people around me, I have friends and family that look at that and they're like, wow, look at you. You're just so fucking smart. You're just such a fucking smart guy. And that's hilarious to hear because that's something that I didn't even learn how to do until I was almost 30 years old, right? How crazy is that? But this is where I learned that cognitive behavioral therapy. This is where I learned how to structure my life via a series of goals and what the steps are to achieve those goals. And that's made the goals in my life much more achievable. That's made me much more successful at achieving the things that I want to achieve in life. And as you can see in these first 3 or 4 steps that we went over, that's exactly what you learn in cognitive behavioral therapy. So that's in general how it'll work. Now, this is the crux of what you're going to be doing in cognitive behavioral therapy, all that working at goals and all the homework and everything else that you're going to be doing. This is the main goal right here, changing your distortions and perceptions, okay? So CBT aims to transform ways of thinking and behaving that stand in the way of how a person would like to live their life. Notice, I think that sentence is really poignant. It's how you would like to live your life. It's not what stands in the way of you living a life that is normal, or you living a life that is just like everyone else, or you living a life that makes you tons of money or successful or this or that, unless you want those things in life. This is thoughts that stand in the way of you living the life you want to live. Because at the end of the day, I think most people would agree, I believe, that success is really living your life the way you want to live. If you're living a life that you want to live, then that's pretty successful. I would qualify that as a success. So CBT helps you with that. All right. Are you understanding here how important it is, or at least how important I think it is? Okay. This involves identifying negative perceptions or distortions that affect behavior. A distorted view can make a person more susceptible to, I can never say that word, susceptible. It's got to be a new goal in my life. Learn how to say susceptible. A distorted view can make a person more susceptible to 1, an unhelpful mindset, 2, jumping to conclusions, 3, mistakenly seeing situations as catastrophic. That's something that I used to do. 4, seeing things as either good or bad with nothing in between. That's black and white thinking. Very common cognitive bias that so many people, including myself, have had. Okay. If people learn fearful or unhelpful ways of thinking, they can start to think this in this way automatically. CBT focuses on challenging these automatic thoughts and comparing them with reality. When a person comes to view a particular situation in a more helpful way, their distress may decrease, and they can take actions or make decisions that are more likely to serve them in the long term. And, I can't stress this enough too. You're more likely to make decisions that you would be afraid to make beforehand. For a very large portion of my life, I thought it would have been so cool to learn how to learn MMA. I thought that would be so fucking dope to learn how to beat people up. There's still that little boy in me that loves that shit. Not like beating up random strangers, okay? I don't do that. Disclaimer. But that would be nice. It would be important. It was important to me to learn how to fight. But for the majority of my life, I didn't have the balls to go do that. Let's just go through it, like jumping to conclusions. I automatically jumped to the conclusion that I wasn't tough enough to learn how to do MMA, and that MMA, learning it, would be incredibly dangerous. Okay, those are conclusions that a lot of people ever end up watching this stream, that those are conclusions that a lot of people would agree are like pretty logical conclusions, right? Like, well, like, how do you know if you're tough enough to go to MMA practice and get punched in the face and get your neck squeezed and shit? Most people would assume that they're not tough enough to do that. And it is dangerous, right? Because you're fucking punching each other in the face, guy. What else do you need? Like, that's dangerous. Those are conclusions that you jump to, though. The reality is, MMA is generally pretty safe. Yeah, things happen. But comparative to, say, driving a car, which is way more unsafe than MMA, there's way more people that die and get hurt every year driving their cars than they do in MMA. And that's, by the way, proportion of the percentage of the population that is driving cars. So that's not, some smart guy would say, well, that's because more people are driving cars, Tony. And Mr. Smart Guy would be like, well, yes and no. It still stands that if you make up for the difference in the amount of population that is doing MMA and driving a car, it's still a higher percentage of those people that are doing it that are getting hurt. See what I mean? So anyways, I would have never had the balls to jump into MMA until I did cognitive behavioral therapy. And at some point I was like, you know what? I think I can do this. Like, I don't know what it actually is, So I'm just going to go in there and I'm going to wing it, and I'm probably going to get my ass kicked, but I'm okay with that. I'm just going to accept that that's a part of doing this. And it ended up being one of the best decisions that I ever made in my life. My confidence skyrocketed after even just a few months of doing MMA. I was like, look at me, I'm Mr. fucking Tony Badass. I can beat everybody up. You know, it made a big difference in my life. So here's a good example, I guess. Here's an example they're giving us. Dental phobia. I imagine that's fear of the dentist. A person with dental phobia may fear going to the dentist. Boom, see, call it that. That's that smart shit I was telling you about. Because they believe they will experience severe pain or even death by having a dental procedure. This fear may stem from a negative experience, perhaps in childhood. See what I mean by building up a lot of these thought processes in childhood. A CBT therapist can work with the person to address this thinking, which says, because I had pain with a filling, all dentist visits will be painful. That's the negative thought process there. CBT encourages affected people to see future dental treatments in a new way. A therapist may also devise a way to approach dental visits in small, manageable steps to overcome this fear. That's known as exposure therapy, which I don't know if we dive too deep into that. That'll probably be another topic for another day, because I have done exposure therapy. I got a good story about my little brother. Maybe one day we can get him on stream to hear about his exposure therapy with women, actually. He didn't have a fear of talking to women. He just didn't think he was good at it, and then put himself in a situation where he was talking to 10, 20 really pretty girls every day for at least a month straight. And it completely changed his life, man. So anyway, here's an example. A 2022 study uses CBT administered by dentists to attempt to overcome dental phobias. Well, we're not going to read that study because I already have a bunch of other studies popped up here for you to take a look at here in a sec. Let's see. Let's just go over this. So what can CBT do during the course of CBT? A person can learn to develop an awareness of automatic unhelpful thoughts. That's a very important one. That's one that I still, that is a skill set that I practiced years after I did cognitive behavioral therapy, and I kind of got out of it in the last year and a half of my life. I would actually sit and counts how many times I would have to stop myself in a day. Like, I would think a negative thought and I'd be like, oh, Tony, you asshole, you're thinking something negative. And I would stop myself and then think something positive. And then I would count that on my phone. Oh, that's one time, whatever. And I would literally count how many times I did that in a day. And I would write it down every day to see if I was getting better at, give it a quantitative value that I could measure to see if I was getting better at catching my negative thoughts. It can challenge underlying assumptions that may be unhelpful, distinguish between facts and unhelpful thoughts, develop a more helpful way of thinking and seeing situations. I'm just checking the audio here to make sure it still sounds good. It does. Okay, moving on. And these are strategies. I think we're going to come back to this here in a second, so we'll save that webpage too. Okay, so hopefully you have a general idea of what CBT is and how it works. Here are some studies to show. Is that studies? This is, well, let's just look at what I have here. These are statistics to give you a rough idea of how effective CBT is, right? If I haven't already sold you on the idea that this is effective, maybe you're sitting there and you're like, well, Tony, that's all good and well. It sounds nice, but it just sounds nice. How do I know it actually works? Well, this is for you, Dick. Here you go. CBT shows a moderate to large effective size compared to control conditions in a meta-analysis of 409 trials involving 52,000 patients. 42% of patients receiving CBT respond to treatment compared to 19% in control groups. Okay, so that's a pretty decent sized number. That doesn't sound like a lot. 42%, well, it's less than half. Well, compared to 19, bro, that's pretty big. 36% of CBT patients achieve remissions versus 15% in control conditions. CBT's effectiveness remains significant at follow-ups with effective sizes at 6 to 9 months and at 10 to 12 months. In inpatient settings, that's when you're talking with a therapist, CBT demonstrates an effective size of G equals 0.65. I don't know what that means. I'm going to be honest with you. I would like to pretend like I was smart enough to know what that means, but I'm not. I'll have to look into what that means. Continuing. 43% of CBT patients report at least a 50% reduction in depression symptoms over 46 months, compared to 27% with usual care alone. So this is something, I have a study pulled up for this. We'll look into this. CBT is something that is helpful with depression. Now, I want to put a disclaimer here. It doesn't cure depression. If you have depression, there's a lot of different, you want to talk to a psychologist, not the dude on the internet, right? But it absolutely helps with depression. It is something that is used usually in conjunction with another form of care if you have depression. Long-term remission rates for CBT are reported as 61% immediately post-treatment, 75% at 6 months, and 63% at long-term follow-ups. So what that means, long-term remission, means remission of whatever your side effects were for whatever your emotional ailment was. So if it was depression or addiction, remission would be continuing to stop the addiction. Or if you had depression, remission would mean not being depressed, obviously. So there you go. And we got more of this G equals nonsense that I don't know what it means. The overall response rate for CBT in treating depression is approximately 50%. We read that. CBT demonstrates an effective size. Oh, there's more of that G equals whatever shit. What's this? Sorry, something popped up in the chat. Okay, this is more what is cognitive behavioral theory, core principles. We kind of went over this. Behavioral activation, that's that changing behaviors. Skill building, that's learning coping strategies. And that goal-oriented approach I was telling you about. So all of that. And then here's this is a little bit different what it works for. We're going to come back for that. Or I think I have a different slide for that. So, this is a helpful chart. Look at this. So if you have depression, primary CBT techniques would include behavioral activation, cognitive restructuring, and activity scheduling. Typical duration would last between 12 and 20 weeks. Well, I don't know about that. Like I said, I did it for about 2 to 3 years, but I didn't need to do it for 2 to 3 years, right? You're thinking, wow, this guy was really fucked up. Like, no, I did it for 2 to 3 years because it was so helpful. Once I was done with it, I was like, damn, like this shit is the bee's knees, son. This is awesome. I'm going to keep up with it. So we went over these comparative effectiveness, response rates, CBT versus others, long-term remission, yada, yada, yada. I think we kind of went over that. That gave us the general gist at the beginning. Okay, and what is this? This is something. Hold on, let me figure out what it is. Caught that burp too. I'm doing a real good job at catching the burps. My cutie pie would be proud of me. The efficacy of cognitive behavioral therapy, a review of meta-analysis. Okay, so let's kind of jump into this. These are some studies that I've collected to even further prove just how effective cognitive behavioral therapy is, or just give you a realistic idea of what the studies are saying, right? So here we have the efficacy of cognitive behavioral therapy. This is a review of meta-analysis. A meta-analysis is when they take a whole bunch of studies and review the results of all of them. So this is reviewing a meta-analysis that was done. Here I got bulimia nervosa, antidepressant or cognitive behavioral therapy is effective. So this, I imagine, because I haven't actually gone over these studies neither, where I'm seeing these for the first time with you. So in some of these issues or some of these studies, it might find like, hey, cognitive behavioral therapy wasn't as effective, but it's effective with this, whatever. This is just to give us more of an idea of how effective it actually is in real world application, right? Then we got another study here, cognitive behavioral therapy with children of alcoholics. Those poor children. Okay. And then I got a couple more here. Let's just pop them up real quick. Cognitive behavioral therapy or antidepressants for acute depression. Yeah, let's read that one. We're not going to go over these entire studies neither, in case you're wondering. If anybody finds this on the internet and they're like, oh my God, this is just a guy reading studies. How boring is that? Well, that's why you're dumb. A comparison of psychoanalytic therapy and cognitive behavioral therapy for anxiety and personality disorders. Presentation of the RCT study design. Okay, so here this one goes over anxiety and personality disorders. This was one for acute depression. This was for those poor chitlin of alcoholics. And then bulimia nervosa. And this was just a general review of the meta-analysis. And I think that was all the studies I had for you. Yeah. Okay, sweet. So let's go ahead and jump into these. We're not going to go over the whole thing. Like I said, I'm not going to go over methodology and stuff like that and bore you with all this basic stuff. And to be perfectly honest, a lot of that shit is above my pay grade too. I am not a trained scientist. I know I look like a very intelligent human being, but I'm not that intelligent. So, not a trained scientist, can't go over the methodology of a study and tell you, like, well, these fucking scientists sure fuck this up. Not my wheelhouse. But I can read the abstract and give you the results. And that's really all we need. So, okay, abstract. Cognitive behavioral therapy refers to popular therapeutic approach that has been applied to a variety of problems. The goal of this review was to provide a comprehensive survey of meta-analysis examining the efficacy of CBT. We identified 269 meta-analytic studies and reviewed of those a representative sample of 106 meta-analysis examining CBT for the following problems: substance abuse disorder, schizophrenia and other psychotic disorders, depression and dysthymia. I don't know what that is. Sounds horrible. Bipolar disorder, anxiety disorders, somatoform disorders. Gosh, I don't know that neither. I think that might have to do with sleeping. Somatoform, somnambulant, eating disorders, insomnia, personality disorders, anger and aggression, criminal behaviors, general stress, distress due to general medical conditions, chronic pain and fatigue, distress related to pregnancy complications, and female hormonal conditions. Additional meta-analytic reviews examine the efficacy of CBT for various problems in children and elderly adults. The strongest support exists for CBT of anxiety disorders, somatoform disorders, bulimia, anger control problems, and general stress. 11 studies compared response rates between CBT and other treatments or control conditions. CBT showed a higher response rate than the comparison conditions in 7 of these reviews, and only one review reported that CBT had lower response rates than comparison treatments. That's pretty good, right? Look at those numbers. In general, the evidence base of CBT is very strong. However, additional research is needed to examine the efficacy of CBT for randomized control studies. Moreover, except for children and elderly populations, no meta-analytic studies of CBT have been reported on specific subgroups, such as ethnic minorities and low-income samples. Okay. So, that's what they generally go over. There's the general results of the study. Let's go a little bit deeper into results. See, we have the method right there. Okay, results. Addiction and substance use disorder. There's evidence for the efficacy of CBT for cannabis dependence. Not to shit on anybody with cannabis dependence, but bro, come on. That's rookie shit. With evidence for higher efficacy of multi-session CBT versus single session or other briefer interventions, and a lower dropout rate compared to control conditions. However, the effect size of CBT was small as compared to other psychosocial interventions, like contingency management, relapse prevention, and motivational approaches. For substance dependence, and agonist treatments showed a greater effect size in CBT in certain drug dependencies, such as opioid and alcoholic dependence. Yeah, so this is something that I did know and was aware of because of friends and family members that I've had that have gone through substance abuse treatment. They've gone through rehab. I have a lot of them. A lot of friends and families that have gone through that. And in general, CBT can be very helpful. Again, helpful is the key word. And getting through a lot of those addictions, it's not going to be the be all end all. You usually want to do it in conjunction with other things. Is essentially what they're saying here is there's other, what do they call them? Psychosocial interventions that are more effective. And combining those with CBT makes for the most effectiveness. But when it comes specifically to opioids and alcohol dependency, those ones are like the heavy hitters, right? Like those are like, for one reason, there's a lot of health issues. If you quit smoking cannabis, weed. If you quit smoking weed, you're going to be a little bums, bro. You're going to be like, well, my fucking life sucks, blah, blah, blah. Quitting nicotine, right? My cutie pie is going through that right now. There's a whole range of different side effects that you can go through with that. You can get weight gain. You can get some, what's the word? You get a little bit annoyed with people a little bit easier, mood swings, your appetite changes. You can get really funky dreams. A lot of different shit can happen with that. And it's tough. It's definitely tough. It's a lot tougher than quitting weed, in my opinion. But opiates and alcohol, quitting those, especially just cold turkey, can kill you. It can actually kill you to quit those things. There's a serious health risk involved. With alcohol, what do they call it? Delirious tremens. So delirious tremens is a pretty serious thing you can get when you're quitting alcohol. I know a person, I know a lot of people who are alcoholics, but I know a person very close to me that was an alcoholic that went through rehab. And before he went to rehab, went to jail. and went through a delirious tremens type episode. And it's pretty scary. You can die from delirious tremens. If you don't know what that is, look into it, because we probably won't dive into it here. We want to save time for going over the actual topic. But opiates, everybody, not everybody, especially nowadays, I forget how young a lot of people are or how old I am now, but I believe it was Jerry Garcia from the Grateful Dead was hooked on heroin. Heroin's an opiate. And he tried to quit and he died from quitting heroin. That's very possible, actually. So these are a little bit more intense. You need more than just CBT to go through it. Let's see. Okay, well, so that gives us a rundown of that. Schizophrenia, that's interesting. Meta-analysis examining the efficacy of psychological treatments for schizophrenia revealed a beneficial effect of CBT on positive symptoms. There was also evidence that CBT is particularly promising adjunct to pharmacotherapy. Oof, that was a tough one. Okay, that CBT is particularly promising adjunct to pharmacotherapy for schizophrenia patients who suffer from an acute episode of psychosis rather than a more chronic condition. So, again, this helps you with schizophrenia, you know? Like, that's pretty crazy. Depression and dysthymia. That's not one I don't know. That sounds horrible. We have acute depression on another study, so we'll go over it there. Bipolar disorder. Meta-analysis examining the efficacy of CBT for bipolar disorder revealed small to medium overall effective sizes of CBT at post-treatment, with effects typically diminishing slightly at follow-up. These findings emerged from examinations of both manic and depressive symptoms associated with bipolar disorder. There is little evidence that CBT is standalone treatment, rather than used as an adjunct to pharmacotherapy. Hey, I've got that word now. Is effective for the treatment of bipolar disorder. So again, with bipolar disorder specifically, hold on. I got like a nose and throat thing going on. Of course, first stream, I ended up being a little sick. So had to mute that nasty noise. Yeah, so again, with bipolar disorder, it's not going to work on its own. It's going to work with something else. You're going to have, in this case, a pharmacotherapy. I don't know what that is, being honest with you. I could imagine I'm going to go ahead and go with the assumption that pharmacy, and pharmacotherapy is some sort of therapy used in conjunction with pharmaceuticals, like with drugs to help with that. Okay. So I don't know if that's the case, but I'm just going to guess, wild guess. Anxiety disorders, I believe we already had that last study covers anxiety disorders, so we'll go over it there. Somatoform disorders. Yeah, what is that? Within the somatoform disorders category, meta-analysis primarily examined the efficacy of psychological interventions for oh, geez, look at this fucking word. I thought pharmacotherapy was a big one. Hypochondriasis and body dysmorphic disorder. Oh, okay, so this is body dysmorphia, hypochondriasis. I would imagine that's like hypochondria. You're hypochondriac, right? Which any of you who doesn't know what that means, hypochondriac is somebody who thinks they have a sickness that they actually don't. One meta-analysis found a large mean effective size for CBT, which outperformed other psychological treatments, such as psychoeducation, explanatory therapy, cognitive therapy, exposure and response prevention, and behavioral stress management. A lot of different treatments there, with effect sizes in the large range, as well as pharmacotherapy treatments, paroxetine, fluoxetine. Okay, so those are all the drugs that they used. I think I got that right on the pharmacotherapy, what that means. Ooh, that was a big one too. Okay, which also evidenced large effect sizes. The mean effect size for control conditions was small. These results were partially supported by other evidence, as more recent meta-analysis found superior outcomes of CBT for hypochondriasis compared to waiting list control, usual medical care, or placebo at 12-month follow-up. Oh, okay, so that was a waiting list control. However, this meta-analysis also found no difference between CBT and waiting list placebos at post-treatment. Oh, that's interesting. So it looks like it has a very large effective size. Let's see, how did it compare to pharmacotherapy? So it was comparable to pharmacotherapy, but it doesn't seem to have any kind of effect on post-treatment. So after treatment, got to go to something else. Eating disorders. We already have bulimia nervosa and another one, insomnia. See, I thought the somatoform would have been insomnia, but I guess not. Okay, CBT for insomnia has long been shown to be more efficacious than controlled treatments. A recent meta analysis examined its efficacy on both subjective and objective sleep parameters in comparison to a control group for individuals with primary insomnia. Effect sizes for the efficacy of CBT1 versus control CBTI is insomnia versus control at the end of treatment on subjective sleep measures, which included sleep onset latency, total sleep time, wake after sleep onset, total wake time, time in bed, early morning awakening, and sleep efficiency, ranged from minimal total sleep time to large. Okay, so it seems to have a very broad range of effect sizes for insomnia. For objective measures using a polysomnogram, I don't know what that is, a polysomnogram, or actigraphic evaluation. God, they have to use such big words for this shit. Makes you feel stupid. Effect sizes range from small to large. Again, very large range. These findings were consistent with results from another meta-analysis which examined the relative efficacy of behavioral interventions for insomnia, including CBT, relaxation, and only behavioral techniques. This study reported effective sizes ranging from, negative 0.75 to 1.47 for CBT, compared to negative 0.60 to 0.53 for relaxation, and negative 0.82 to 0.91 for behavioral techniques only. So compared to relaxation, CBT is better for insomnia. And it looks like it has a broader range of being worse to better for behavioral only techniques. But on the top side of that, the efficacy is much higher on the top side of that range. Personality disorders. Let's see, how are we doing for time? We're at 109. Okay, sweet. There was one meta-analysis that examined the relative efficacy of CBT versus psychodynamic therapy for the treatment of personality disorders. The findings indicated a large overall effect size for psychodynamic therapy compared to CBT. Okay, so this would be one example where CBT is probably not what you want to do for personality disorders. I would be interested in finding out what the personality disorders are. This was consistent with observer-rated measures, which showed a similar pattern of effective sizes, stronger for psychodynamic therapy than for CBT. Although this effect size was also large. Oh, okay. Self-report measures, however, indicated larger effect sizes for CBT than for psychodynamic therapy. Ah, interesting. Here, we got another meta-analysis compare the efficacy of 11 different psychological therapies, including CBT for antisocial personality disorder. Results suggested that compared to control treatment, CBT plus standard maintenance was more efficacious in terms of leaving the study early in cocaine use for outpatients with antisocial personality disorder and comorbid cocaine dependence. Oh, wow. However, CBT plus treatment, as usual, was not better than a control condition for these antisocial personality disorder patients with regard to levels of recent verbal or physical aggression. Okay, the relative efficacy of psychological treatments for borderline personality disorder in particular was also examined, which yielded no differences between dialectical behavioral therapy and treatment as usual in individual meeting criteria for borderline personality disorder at 6 months or in hospital admissions in the previous 3 months. Okay, so in general, what this looks like is CBT works really well for personality disorders, but psychodynamic therapy works better. I don't know what psychodynamic therapy is. That would be kind of cool to read about that in a future stream. Let's see. Let's take a look at what else it said. It did say that that was one meta-analysis, by the way. That said that. And there was only one other meta-analysis that compared 11 different therapies, including CBT for antisocial personality disorder. Looked like CBT was more efficacious for the most part, not only in antisocial personality disorder, but in comorbid cocaine dependence. But it wasn't better than the control condition for these antisocial personality disorders in regards to levels of recent verbal or physical aggression. Oh, interesting. So CBT didn't help with recent verbal or physical aggression in people with antisocial personality disorder. Okay. Okay, and then anger and aggression. 2 meta-analytical reviews focused on anger control problems and aggression. These findings from this meta-analysis suggested that CBT is moderately effective at reducing anger problems. Finding from these reviews also suggested that CBT may be most effective for patients with issues regarding anger expression. CBT produced medium effective sizes as compared to other psychosocial treatments, and control conditions across the 2 reviews that conducted quantitative analysis. A meta-analysis on the effectiveness of anger treatments for specific anger problems included only studies in which subjects met clinically significant levels of anger on standardized anger measurements prior to treatment. This meta-analysis examined the effects of CBT, cognitive therapy, relaxation, and other, which includes social skills training process, group counseling, on various anger problems, including driving anger, anger suppression, and anger expression difficulties. So it looks like it's not the best with anger, right in the middle, though. But still doesn't mean it's not effective. It's still effective. It just, there was other psychosocial therapies that seem to be more effective. Criminal behaviors. So they did 4 separate meta-analytical studies supporting the efficacy of CBT for criminal offenders. Oh, wow. Out of several theoretical orientations and types of psychological interventions for criminal activity, behavioral therapy and CBT appeared to be the superior interventions in reducing recidivism rates, both with medium mean effective sizes. Effective sizes for other interventions ranged from small to medium. Another study demonstrated consistent findings with a small weighted mean effect size of behavioral therapy or CBT for reducing recidivism. Similarly, another study found an overall small to medium mean effect size for CBT programs for convicted offenders. For sexual offenders in particular, physical treatments such as surgical castration and hormonal treatment were demonstrated to have greater efficacy in reducing sexual recidivism in comparison to CBT. Well, I mean, shit, if you're cutting somebody's balls off, then yes, that's a good way to get them to stop raping people, sure. It's basically what they're saying. With large significant odd ratios for both of these alternative interventions. Of the various psychological interventions for sexual offenders, however, classical behavioral and CBT approaches indicated the stronger efficacy, with odds ratioed in the medium to large range. Oh, see, that's as compared to insight-orientated and therapeutic community interventions. All right, so CBT works for everything short of cutting their balls off. That's good. That's good. General stress. 4 meta-analyses examined occupational stress, and the majority of their results were quite similar. CBT interventions were more effective in comparison to other intervention types, such as organization-focused therapies, especially when CBT focused on psychosocial outcomes and employees. For example, this study found CBT alone to be more effective in comparison to CBT combined with additional psychological components. Really? What? Did I read that right? CBT alone was more effective. See, that's a rare one. You aren't usually going to see that. Usually CBT works best with something else, but in this case, it worked better alone, just for general stress, in that one study. These studies found a large effective size for overall CBT interventions, large effect size for single-mode CBT interventions, and small effect size for CBT interventions with 4 or more components. In contrast, another study chose not to compare CBT with other interventions, such as relaxation techniques for psychological stress, because most interventions comprise both elements and could not be evaluated separately. With respect to stress in parents of children with developmental disabilities, positive effects were found for CBT, but the effect size was relatively small. In contrast to the results with this study, Richardson and Rothstein, this meta-analysis found multiple component interventions which combine CBT, behavioral parent training, and in some cases other forms of support services to have a higher and larger effect size in comparison to CBT alone. Okay, so that's more common, right? But still, you have a range of studies there. It looks like for general stress, one study found that it's pretty small, but that's for stress in parents with children that have developmental disabilities. Another study found that it's large, not as large as combining it with other types of therapy for those same parents that have children with developmental disabilities. In just general stress, there was a study that showed that it was best by itself. That's pretty crazy. How many more of these do we got? Distress due to medical conditions, chronic pain and fatigue, pregnancy complications, CBT for special populations, elderly adults, response rates of randomized control studies. Yeah, let's save the rest of this for a little bit farther into the stream. Just because I'm getting a little bit bored with reading them. I'm going to be honest with you. Let's dive over to these other 4 studies. I want to get to those because those are very specific studies. This was a meta-analysis of multiple studies. That's why in the lingo, if you've caught on, I'm saying, oh, well, this study found this and that study found that. That's what a meta-analysis does, is it gives you the gist of what all these different studies found, which is very helpful. When this says, oh, CBT has a large response size, it usually means it over several studies, unless it indicates, oh, this was just one study that did this, right? So here, we're going to go over very specific studies. And again, we're just going to give you the very brief. I don't even know if we need to go over the abstracts. We could probably just dive into the conclusions. Conclusions and the, I'm forgetting the word. What is it? Results, if they have them. If it's clearly marked, I'm not going to scroll through this whole thing quietly while you sit there just defines the results. We can just go back to the other page and review, because I imagine this study is probably going to be in that meta study, depending on when the two are done. Let's see. Yada, yada, yada. Da, 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 da. Da, 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 da. Community care. I don't know what that means entirely. Is this a study, or is this actually an article written on a study? Oh, it's a journal article written on a study. So, okay. Well, I was excited to read that, but I guess my excitement was a little bit premature. I guess there's your answer right there. Antidepressant or cognitive behavioral therapy is effective. Let's just go back to the bulimia section of this, because it was short and sweet and easy. I didn't have to try to weed through it. Okay, no, bipolar. Depression. Was that bipolar? Yeah, bipolar disorder. Anxiety disorders. Somatoform. Body dysmorphic. Bulimia. Eating disorders. Here we go. Okay, for bulimia nervosa, meta-analysis compared the efficacy of CBT to control treatments and found effect sizes in the medium range. However, the effect of behavioral therapy was greater than that of CBT, with the average effect size for behavioral therapy in the large range. So that was one meta-analysis. Another meta-analysis comparing CBT with control treatments found remission response rates to be higher for CBT with a medium relative risk ratio. When comparing CBT to other psychotherapy, specifically interpersonal therapy, dialectical behavioral therapy, hypnobehavioral therapy, supportive psychotherapy, behavioral weight loss treatment, and self-monitoring, CBT fared significantly better in remission response rates for bulimia nervosa with a large relative risk ratio. So I'm not entirely sure what the risk ratio thing is about, but I would imagine that a smaller ratio would probably be more beneficial. I'm just winging that out there than a larger risk ratio. I don't know. For binge eating disorders, a recent meta-analysis found that psychotherapy and structured self-help yielded large effective sizes when compared to pharmacotherapy, which yielded medium effective sizes. Although this study did not parse out the efficacy of CBT specifically, a majority of the included trials for psychotherapy involved CBT, 19 out of 23. Furthermore, a review and meta-analysis suggested that combination treatment of psychotherapy and medications did not enhance binge eating outcomes, but may have enhanced weight loss outcomes. Okay. So, it looks like there's decent support for CBT and binge eating, but there wasn't any strict CBT specific studies. It was all just psychotherapy in general, which psychotherapy isn't the same as CBT. There's a lot of, it's kind of like psychotherapy is a group of different kinds of therapy, and CBT is one of those types of therapies. But it did seem like CBT was only medium. The effect size was in the medium range for bulimia nervosa. One study actually found that it had a higher, that remission response was higher. So that's pretty good. And then another one found that the remission response rates for bulimia nervosa were significantly better than various other types of psychotherapies. I listed all of them beforehand. So in general, it seems like it works good. You know, like these people say, antidepressants and cognitive behavioral therapy is effective. We're just going off that headline. I hate to just read headlines. That's like a meme at this point. You only read the fucking headlines. Well, that was a big article and I don't have a lot of time. This is another article. See, I thought these were going to be actual studies. I misread. Cognitive behavioral therapy with children of adolescence. So this goes over characteristics of childhood adolescence. Yeah. So these are different types of children that come from parents who are alcoholics. You get the mascot, you get the lost children. The lost child is the child that's essentially ignored by the parents. The mascot is the one that is, put front and center in the family. You are here to prove to the rest of the world how amazing our family is. Placaters are children this is that maladaptive behavior. A placater is a child when they grow up in a house with an alcoholic mother or father. It can be effective. A effective behavior you'll learn as a child that if I just placate my parent, then that avoids any potential abuse, either verbal or physical or otherwise. Or just avoids scary situations, right? If my mom or dad, whoever's the alcoholic in the family, is going to start yelling or screaming when they get drunk over stupid things, then you learn very quickly to just, this is what they want to hear, tell them what they want to hear. Again, in later years in your life, that will not be a very effective behavioral trait. It's not going to be effective to placate people every time a confrontation arises. In some cases, confrontation is better faced head on without placating the other individual, right? So that's a behavioral trait that can come from being the child of an alcoholic. It is very surprising how many maladaptive behaviors a person gets from having a alcoholic parent. That's one of them. Scapegoat's another kind of child. Family hero, I think that's kind of like the mascot. Oh yeah. So the oldest children in a family take on the role of family heroes. They believe that they can cure the family by being overly responsible. So essentially, the heroes usually tend to be the oldest sibling of a parent with alcoholism. They tend to take on the responsibility of the younger children. And that essentially just means the maladaptive behavior from that is you grow into needing to be responsible for everybody around you, right? Like if somebody's sad, it's your responsibility to cure them. And again, not a very effective way to go about life. So cognitive behavioral therapy overview. This is what we're really interested in. Doing good on time. We got about an hour left. How far am I? Right. Okay. So let's speed along this. Relationship building assessment. Okay. Intervention techniques and applications, goal setting, treatment plan. This is going over the actual how they would go about. Wow, that's a very interesting study. So this is the actual how-to of how they talk to these kids. Implications for school counselor, and there's your references. Let's just go over that basic for it real quick. Okay. CBT, with its educational framework, is a viable intervention approach with COAs, children of alcoholics. They are taught new ways of thinking, feeling, and behaving to replace problematic behaviors. Bunch of studies. Okay, CBT, based on the works of Ellis and Harper, assumes a causal relationship among thinking, feeling, and behaving. CBT posits that an individual's thoughts or self-talk mediate between that individual's feelings and behaviors. Additionally, it posits that all behavior is learned and more appropriate and effective behaviors can be learned. We already went over that. CBT is a brief, time-limited, problem-oriented approach based on a sound, collaborative, therapeutic relationship. Counselors are active and directive and use an educational model for behavioral change. Homework is a major component of treatment for the COAs, not for you. Through the counseling process, CBT counselors seek to help COAs to change faulty thinking to foster more appropriate feelings and behaviors. CBT counselors collaborate with children and teach them to identify, analyze, and change illogical beliefs, which affect feelings and behaviors. So we kind of already went over that. This is generally going over what CBT does for COAs, but right there was the main thing I wanted to get across to you. CBT is a viable intervention approach to children of alcoholics. And this is cognitive behavioral therapy for antidepressants or acute depression. Both options look equally effective, although evidence is limited. Okay. Well, and this is again another journal, another article from another journal, and I only have about 50 minutes to go, so we're not going to dive too deep into these. We're going to kind of run through these again. First stream, I'm kind of winging it. I don't know what the time frame is going to look like. I might end way too early, or I don't think I'm going to get through any of this too early. We'll see. And last study that I had, or article, I guess, a comparison of psychoanalytic therapy and cognitive behavioral therapy for anxiety, personality disorders. Oh, and this is in German. That's awesome. There is a way for me to. How do I translate to English? Boom. It translated the webpage to English, not the article. Bummer. Hold on, let me see if this. Nope. Okay, well, unless any of you could read German. Oh, wait, no, here we go. It goes from German back to English. Okay. So, summary, design. Okay, the multicenter anxiety and personality disorder study investigates 200 patients with panic disorder and/or agoraphobia with comorbid personality disorder in a randomized control group comparison of psychoanalytic therapy and cognitive behavioral therapy, including 100 patients in each group. Each patient will be examined over a period of 6 years, regardless of the duration of the individual treatment. The main issues that are addressed in this study are the comparison of the efficacy of PT and CBT in this special patient population, the comparison of the sustainability of the effects of PT and CBT, the comparison of the long-term cost of benefit ratios of PT and CBT, as well as the investigation of prescriptive patient characteristics for individualized treatment recommendations. So there's a background, prevalence of comorbidity, effectiveness of treatments for anxiety disorders. The following overview focuses on the treatment of panic disorders. Okay. A number of RCT studies and meta-analysis have shown overall evidence for the effectiveness of CBT for panic disorders and agoraphobia. Concerning the sustainability of the effects of CBT, findings are contradictory. So it's effective, but sustainability of the effectiveness might or might not be there. Some studies found long-term success for CBT over a period of 1 to 2 years. Other studies indicated that improvements of patients treated with CBT are not always stable in the long run. Patients relapse and/or further therapy. Okay. Comorbid mental disorders, especially PDs, don't know what that is, are no negative predicators of therapeutic outcomes. However, there are a few RCT studies on PDs. For borderline, PDs are personality disorders. Okay, for borderline personality disorder, which is investigated best, different forms of CBT have proven to be effective. Dialectical behavioral therapy, schema therapy, and systems training for emotional predictability and problem solving. And recent meta-analysis of studies investigating predicators and moderators of improvement in CBT for panic disorders and agoraphobia. This study found that agoraphobic avoidance was the most consistent predicator of decreased improvement. So those are just potential predication or predictions for how a person will respond to the training. Effectiveness and sustainability of psychoanalytically orientated psychotherapy for anxiety disorders and PDs. So I'm just going to run over this in a nutshell. In direct comparison with CBT, CBT was superior in some specific outcome parameters at the end of treatment. Longer follow-up studies for short-term psychodynamics psychotherapy are still lacking. There are only a few RCT studies on the effectiveness of PT in general. Overall data indicates effectiveness of PT, that's psychotherapy, but studies investigating specifically anxiety disorders are missing. So, in general, CBT is much more effective for personality disorders and anxiety disorders. And then this goes over the methods and designs. I'm just kind of going through it just to see all the pretty graphs. Hypothesis, measures, data collection. We're not going to go over that. Discussion, references, and I think that gives us all. Okay, so, all right. What I've been talking about for the last half hour is just showing you different things that CBT is effective for. different ways that it is effective, how the outcomes of how the outcomes of CBT have been for these specific disorders. So, and as you can see, for the most part, it covers a very long range of emotional and mental disorders and is pretty effective across the board. More effective in some things than other things, but the effectiveness is there, right? So the idea there is just to give you an idea. If somebody, again, nobody's really watching, thank God, because I'm pretty sure I stumbled over my words multiple times there. There's probably multiple burps I got through the mic. But in general, I'm surprised with how few technical difficulties this stream has had. I was expecting shit to just blow up, things to just go absolute ham over here. The kids still say ham. Is that still a thing? So, but it worked really good. The stream has so far. So, we only got about 50 minutes left. What I just wanted to show you, what I wanted to do was just kind of go over all those basic, but go all over all those different types of mental and emotional disorders that a person could have in the event, because I am going to put this on YouTube, in the event that somebody catches this video on YouTube and just happens to notice their particular disorder on there. There's a study showing how CBT fares for somebody with your specific disorder. And hopefully, if somebody has a disorder like that, this would kind of convince them that maybe they want to look into CBT. Okay, so what were these slides now? So in childhood anxiety, CBT helps by normalizing hyperactive brain circuits. Oh, wow. Oh, yeah. So this was just a whole nother list, man, that we don't have time to go over, but a whole nother list of shit that CBT helps with. Here it's helps with childhood anxiety, combined with psychotreatment, helps schizophrenic patients. When mothers got CBT for postpartum depression, emotional regulation in their infants improved. One-day online CBT workshop helped new moms with postpartum depression. Research identify a neural signature centrally important to restructuring. That has nothing to do with anything. Okay, but this was just, we got 3 pages of more articles and studies showing you what CBT helps. So in short, my 30-minute point that I was making was it fucking helps. All right. So if you doubt it, doubters, haters, take that shit somewhere else. Okay. Cause this shit works. And okay, here was cognitive behavioral therapy worksheets. Get out my face. What is cognitive behavioral therapy? I think we went over that already, didn't we? What did I have this saved for? Hold on, let me check my little... Oh, these are techniques, effective techniques for it. There's strategies, more strategies, techniques. And here was what can it treat? So this was just I think at this point we're all probably on the CBT gravy train. But here's just another very brief rundown of everything that it helps. It helps ADHD. We didn't go over study that showed that, but this all comes from a 2021 review suggesting CBT can be effective for a variety of mental, physical, and behavioral conditions in the short term, including ADHD, generalized anxiety disorder, depression, eating disorders, hypochondriasis, chronic fatigue syndrome, fibromyalgia, substance misuse and addiction, panic disorder, post-traumatic stress disorder, and tinnitus. Tinnitus, wow. Interesting. CBT compared to other types of therapy, dialectical behavioral therapy. Oh, so these are just these different types of... Oh, yeah, that's interesting. Eye movement desensitization. I actually have that on another, because I have actually done the eye movement desensitization and reprocessing therapy. That's EDMR. It's typically referred to. You'll actually look behind me. Hold on, right there, that bar right here where my fingers is. That's an EDMR bar. I did EDMR therapy as well. We'll go over that in another stream. Focused animal assisted therapy. That sounds fun. Anything with animals is awesome. Okay, we probably don't need this slide no more. And then this was risk and benefits. What was this again? How it works. We already went over that. Recovery and outlook. Okay, so in general, CBT works for a whole lot of stuff. It's a very effective form of therapy for a whole bunch of different disorders. We went over what the effectiveness was for a lot of those disorders, and it ranged from small to high, right? I am suddenly now. See, I was rushing through a lot of that because I wasn't sure if we would actually make it in time. I was like, oh my God, I only have 40 minutes left. I got to rush through all this. And now I only have 2 slides left. And I'm like, oh fuck, I think I'm going to end early. But let's go over it. We'll see. Let's just wing it, see how it goes. Okay. All right. So CBT techniques, 25 cognitive behavioral therapy worksheets. And this was a bit of a shorter one, right? This was techniques, CBT techniques. Oh, wait. Wasn't there another slide that I had for techniques? Nah, screw it. I don't think I had it. Okay. Several core principles, strategy, treatment. So, yeah, let's just go over this, see if it's helpful. CBT treatment usually involves efforts to change thinking patterns. We already know this. These strategies might include learning to recognize one's distortions in thinking that are creating problems and then to reevaluate them in light of reality, gaining a better understanding of the behavior and motivation of others, using problem-solving skills to cope with difficult situations, and learning to develop a greater sense of confidence in one's own abilities. So yeah, this next section I wanted to go over was just some techniques you're going to typically find in cognitive behavioral therapy. I suppose I actually have a whole bunch of my old notebooks down here. I could probably go over a whole bunch of the techniques that I personally used when I was in cognitive behavioral therapy. That might be kind of fun if we're short on material and I still got a whole lot of time left. I'll probably do that. But in general, I just wanted to give you an idea of the kind of stuff that you're going to be doing in cognitive behavioral therapy. Learning to recognize your own distortions. We kind of already talked about that, getting into the habit of picking up on when your thought process is negative or you're having a biased thought, you're jumping to conclusions. Learning how to spot when you're doing that is very effective. Gaining a better understanding of the behavior and motivations of others, that's an important one. It is really beneficial and reassuring to sit with a therapist or somebody else. Aw, my cutie pie texted me. So yeah, where was I? Oh yeah. So it is very reassuring to be able to go to a therapist and be like, I think everybody hates me for this reason, or everybody does this, or everybody thinks this about me, and learn that most of the people in your life don't give that much of a fuck. Not in a bad way. Like, if you fell off a cliff tomorrow, they'd be like, oh, there went Tony. Gosh darn, I guess I'll go get another one at the Tony store. Like, but more like, they are busy thinking about themselves. That's normal. Everybody does that. Most people are too busy thinking about how everybody's thinking about me than they are thinking about you, if that makes sense, right? They're doing the same thing that you're doing. And having a therapist show you studies to prove that is very beneficial. It really helps you get out of that mindset of like, oh gosh, I can't do this because there's so many people freaking out, or because there's going to be so many people that see me do this and it's going to be embarrassing, like streaming for the first time, right? This is something that I had talked to a couple friends before I started streaming. I had talked to them about it. And they're like, yeah, man, I always wanted to do that, but it's nerve-wracking to go on stream and then know that people are watching you. And in my case, I was like, most people ain't going to be watching me when I first start, bro. Like, I got my cutie pie in the chat telling me I'm doing good. And that's what I got. And so this makes this a lot easier, right? Being able to, and CBT helps you to have that more realistic view of the situation where it's like, well, this is my first stream ever, dude, and it's going to suck. It's going to be bad because it's my first fucking stream, right? You don't do anything for the first time and you're good at it. You're going to suck. There's going to be issues. You're going to have technical difficulties, right? And so like an echo that pops up at the beginning of your stream, that type of shit's going to happen. And the more you do it, the more you know not to do this or that or the other thing. And it gets a lot easier. But having that realistic mindset makes things a lot easier to do. It made coming down here and doing the stream a lot easier to do. and I was able to have more fun doing the stream, right? I had more fun putting my streams together and talking about things that I'm interested in, knowing that one, this isn't supposed to be amazing right now because it's my first time, and two, nobody's really watching anyway, so I can fuck up as much as I want, right? If I miss a fart or a burp with that mute button, most people ain't gonna see it, so it's all good. That kind of thing is important to know. And again, CBT helps you gain a better understanding of people and how they act in the world around you, so you can make a more realistic idea of what it means to go do something for the first time, whether it's streaming, going to the gym, doing anything. The gym is a big one. I have so many people, including myself, a huge part of when I got done with CBT was getting more physically healthy, going to the gym and spending more time working out. It's been years and years now that I've been going to the gym, and it's just a regular part of my daily, uh, um, um daily, what's the word I'm looking for? Routine. It feels weird to not go to the gym, right? It kind of like bugs me when I don't get to the gym. I have to do something else. Like today, I didn't go to the gym because of my fucking throat thing. It was like, I won't go to the gym, but I'm doing my first stream, so it's okay. I have something productive that I'm going to do so that I don't feel like I'm a lazy asshole for not going to the gym, right? It's turned into that sort of thing. And you talk to gym rats, a lot of them will tell you that, where they're like, oh, yeah, if I don't go to the gym, I feel like I got nothing done today. And so, whereas you talk to people who it's been years since they've been to the gym, they're like, I can't even fathom what that thing's like because I'm so afraid of going to the gym. I can't even envision myself going to the gym every day and being like you. And, before I did CBT, I couldn't either. Before I did CBT, I would only work out at my apartment complex's little workout area, the little mini gym that they had there. And I was so embarrassed to be caught, but to have people watching me work out, that I would wait until about 11 o'clock at night, 11 p.m. to start working out. So nobody would ever come in. And then at my apartment complex, I had a security guard that I used to sell acid to, and he would come in and start fucking talking to me when I was in the middle of my workouts. So it was like, bro, like I'm working out at 2 a.m. to avoid this situation right here, man. Like I don't sell you acid to be your friend. I sell you acid so you stop fucking talking to me when I'm trying to work out. And eventually once I went through CBT, it was a lot easier to just be like, oh, hey, you know what? I don't really know what's going to happen at the gym. I have no frame of reference. So I'm just going to go and I'm going to wing it. And you know what I realized is everybody at the gym, about 75% of the people at the gym are probably worried about other people looking at them, right? You're going to go to the gym being like, oh my God, I think that I'm too, like, people are going to know I don't belong here because I'm fat or because I'm not lifting a lot of weight or because I'm super skinny. It changes on what your body goals are. And you're going to go to the gym and you're going to see people who are much more obese than you, much skinnier than you, lifting a lot less weight and doing a lot more embarrassing shit and dressed a lot more embarrassing than you are. And they're going to be working out and you're going to be like, how can that motherfucker work out and not care what people think of him? And it's like, well, they do care just like you do. They're just here and they're doing it, same as you. And eventually you're going to get to the point where you're in that 25% of people who go to the gym every day, no matter what, and they don't give a shit if people are looking at them or not. And that's either because they've been doing this long enough that they've adapted to the situation. It's not even a thought that goes through your head that people are looking at me. Two, you've molded yourself into a person where you actually like the idea of people looking at me, right? You get done with your, your biceps and you're like, oh yeah, you're in front of the mirror like, does anybody else see this shit? Like, or you've had such embarrassing shit happen to you at a gym that you're okay. Now you're like, I don't care if people look at me because there was that one day I came to the gym and just fucking made a complete ass of myself and everybody saw it. So now I don't give a shit if anybody sees me just bench pressing, right? And I have a good embarrassing story for that I share with a lot of people. My cutie pie knows. I've told her that story. I might share it on air one day. Maybe at the end of the stream if I have time. I'll share that with you. So that's a very important aspect of CBT too. Using problem-solving skills to cope with difficult situations. Again, the type of problem solving skills that you're going to learn are kind of specific to whatever your specific issue is, but you'll learn all kinds of problem solving skills when you're in CBT. And of course, a greater sense of confidence. Like I said, with the MMA thing, your confidence in your ability to take on new situations and new challenges in your life goes through the roof. And everybody needs that. Everybody wants that, right? Okay, CBT treatment also usually involves efforts to change behavioral patterns. These strategies might include facing one's fears instead of avoiding them. That's that exposure therapy. Using role playing to prepare for potentially problematic interactions with others, and learning to calm one's mind and relax one's body. That last one, the first one, and all three of those are pretty important. To be honest, I don't particularly do like role playing, but visualization is something I did for a very long time. When you're taking on a new goal in life, being able to sit, meditate on it, and visualize yourself going through the actions can be very helpful and beneficial and give you a level of confidence. Facing your fears, one of the most important things you can do in your life, man. I, could do a whole entire stream just on facing your fears, exposure therapy. I think I might do that at one point because it's so important to growing as a person. If you have things you're afraid of, you have to. You have to challenge those fears. You have to face them. It's a must because it's one of the most effective avenues through which you are going to grow as a person. There's a lot of ways for you to grow as a person and become a better person, but if one of those fail-safe methods of becoming a better, more intelligent, more capable person is facing your fears. That's one of the number one best ways to do it. If you're not at least thinking about doing that, if you're not exploring that in your life, then you're leaving a lot on the table in terms of who you could be, right? Even if you're cool with who you are now, you could be awesome. You could be the most coolest motherfucking cool Joe in the world. And you're still leaving a lot on the table if you have fears that you haven't faced. And there's so much growth that is possible there that it's worth taking time, even outside of cognitive behavioral therapy. Even if you're like, yo, I'm like such a fucking stable motherfucker, I don't even need this shit, Tony. Well, bully for you. But it would still be worth your time to write down a list of your biggest fears and pick one to start facing. Like pick one to face and start using that the way I do my goal list, right? Face this fear. How are you going to go about facing it? Baby steps to facing it. It's worth your time because there's so much to learn about yourself and so many ways to grow through that one tiny avenue. And then learning to calm one's mind, relax one's body. Meditation is something that I learned about in CBT. I didn't focus on it a lot in CBT, but I did end up focusing on it a lot in my spare time outside of CBT because it was very effective. Because learning something like box breathing, which we'll actually get into later into the month, I got a stream on that covers box breathing. It's a way to calm your mind down in a stressful situation. Very important skill set to learn how to develop, right? So those are some things you're going to develop, some skill sets you'll develop in CBT. And this is some of the techniques, hopefully. Let's look at the key insights. Let's see what this says. CBT helps individuals identify and alter negative thought patterns. Yeah, we know that. Key CBT methods include cognitive restructuring, behavioral activation. Yes, exposure therapy. Yes, we know that. Utilizing CBT worksheets facilitates self-reflection and supports the development of healthier coping strategies for lasting change. So some of these CBT worksheets, I wanted to show the slide because this is probably going to be comparable to some of the things that I found on the internet when I was going through CBT and in some of the CBT books that I read and some of the things that I did in my spare time outside of the actual therapy portion of it. To help myself get better. Let's see. 9 essential CBT techniques and tools. Let's take a look. Journaling, self-reflection, identifying thought patterns. So journaling is definitely a good one. I did journaling for a little while. I would have to pull out my old notebooks, which might be worth doing because we got about little under half an hour anyways. So that might be worth taking the notebooks out. Hold on a second. let's see if I can just pull one of these guys out randomly that has to do with CBT. Nope, not CBT. Let's take a look at this notebook. I keep every notebook that I've ever had throughout my life. I have notebooks sitting under my stairs that I had when I was like 10, 11 years old. Nope, this is an entire notebook full of my dieting. Monitoring calories. Look at this one. This is a big one. What's in this one? Aha! Here we go. This is a CBT notebook. We struck pay dirt. Okay. So, I don't know exactly if there's going to be any journaling in this one, but this one is pretty close to the general idea of journaling. So, I wanted to do a stream completely, what's the word? A separate stream that is exclusively just on this technique of mine that I used to employ that was very, very helpful. Where essentially what I would do, I don't know if you can see it without the camera going out. Probably can't. So there's the date right there. I'd put the day. I would go in 21-day cycles, I believe. It's been so long since I've done this. 21-day cycles, 3-week cycles. And I had 6 positive affirmations or positive thought loops that I wanted to burn into my brain that were the opposite of negative thought loops that I had identified in cognitive behavioral therapy. And I had 6 of those thought processes we talked about, thought processes, core beliefs. This was 6 core beliefs that I had found through therapy that were very negative and maladaptive core beliefs that were really fucking up my life. And then 6 positive core beliefs that I could replace those negative core beliefs with. And to work on each one of those core beliefs every day, I had 1 or 2 specific habits, things that I needed to do that day. And what I would do is I would write down the date. I would write down a number that corresponds to each specific item. And each item, I'll go into a little further explanation. Each item is a technique that I had to employ at some point in the day that would help me solidify that positive core belief. And when I did it, I would award a point system I had to myself. I had a point system. I would award myself points, and I would play essentially a game with myself. So every day that I accomplished this technique, it was worth 1,000 points. And I would write that down, 1,000 points. This was and then at the end of the day, I would tally up how many points I had. At the end of the 3 weeks, I would tally up the total points that were available for me to make each day, and total points that I got each day. Add those up, do some quick, simple math, and then I was able to give myself a letter grade on how good I was at employing these techniques. So this was a method for me to build habits. It was a method for me to motivate myself to continue with cognitive behavioral therapy, to employ these techniques and make it a little bit funner and easier for me to essentially journal, to record how often this was happening and was it taking effect. And then at the end of the week, because I was usually dieting when I did this, my points, I would use them as I essentially had a store. Like if I got 12,000 points at the end of the week, then I could order myself a pizza. And a pizza would cost 2,000 points. So I would get to eat a big ass cheese pizza at the end of those 3 weeks if I had tallied up enough points. And if I had tallied up enough points, then I would get to spend a whole weekend of just eating my favorite sugary cereals and watching my favorite anime costs 6,000 points. And so if I had 12,000 points tallied up at the end of those 3 weeks, it would be great, I can eat 5 pizzas this week and spend the whole weekend in my Jimmy John's watching Dragon Ball Z. And that was my gift. That was a way to celebrate and reward myself for sticking with my CBT, but only if I did everything every day, the way that if I continued with these techniques. So it was a very clever way that I had devised. That was my own making. I thought of this to keep myself in line with these techniques. And it's not actually journaling. What they mean by journaling is actually journaling, writing down your thoughts. At one point, this system of mine, I did employ journaling, but I, at some point, would switch techniques in and out to figure out which technique was the best for what particular thing I needed to do, what particular core belief I was trying to implement. And I'll go a little bit deeper into that, but let's talk about these 9 essential CBT tools a little bit more. Nightmare exposure and re-scripting. Interesting. Oh, look. Hey, they tell us what they are. Okay, let's go over these then one by one. So, journaling. This technique is a way to gather about. I don't know if that sentence structure is correct, but whatever. This technique is a way to gather about one's moods and thoughts. A CBT journal can include the time of the mood or thought, the source of it, the extent or intensity, and how we reacted, among other factors. This technique can help us to identify our thought patterns and emotional tendencies, describe them, and change, adapt, or cope with them. So, nasty human noise. So, this is a way for you to essentially just gain insight into how your brain works. How often do I have this thought or that thought? How do I emotionally react to these kinds of thoughts? What is your brain doing, right? Unraveling cognitive distortions. Where's the nightmare thing? Nightmare exposure. Okay, we'll just go down them in this list. They kind of fucked up the order. Unraveling cognitive distortions. This is a primary goal of CBT and can be practiced with or without the help of a therapist. In order to unravel cognitive distortions, you must first become aware of distortions from which you commonly suffer. Part of this involves identifying and challenging harmful automatic thoughts, which frequently fall into one of the 15 categories listed earlier. I don't know what those 15 categories were. Oh, here's interesting. These are... What are these? Cognitive distortions. Oh, okay. So tune in next week because I actually have a whole stream on various types of cognitive biases and distortions. Filtering, polarized thinking, black and white thinking. We went over that. Overgeneralization, jumping to conclusions. We went over that. Catastrophizing or magnifying or minimizing. Catastrophizing is crying over spilt milk. Personalization. This is a distortion where an individual believes that everything they do has an impact on external events or other people, no matter how irrational that might be. Personalization is a common thing that you indulge with if you're the hero child of an alcoholic parent. We kind of went over that earlier in the stream. The hero child of an alcoholic parent usually is the older child that feels like they need to take responsibility for the younger children. A common maladaptive behavior from living in that kind of environment from the first 18 years of your lives is this feeling of like every move I make is going to have an effect on the people I take care of. And so there's a bit of it kind of forces you into what's the word that I'm looking for here? It stops you from making any action, basically. It stunts you from being able to make any choices. You're too worried and scared to make a choice or a decision or an action because you feel like any action I make, the consequences are going to be suffered by the people around me, because that's how it was in life when you were younger. Any consequence of your action, your siblings felt, because you are the person who's taking care of them. And sometimes when you're a kid, it can hit you really hard when you make a wrong decision and you fuck something up for somebody beneath you that you love and care about. You take that into adulthood and you have this feeling of everything I say or do is going to be catastrophized by everybody else around me. It's going to fuck up their lives if I do the wrong thing. And the truth is that's not the case. It just isn't. Most of the time, now if you're going to go drinking and driving, well, yeah, that's probably something you should personalize a little bit and not do. But for the most, this, in the way that it's a disorder or a bad maladaptive behavior, it affects people in minuscule ways where you'll feel like, oh, I can't take the time to do this, or I can't do this. I can't walk up to my boyfriend or girlfriend and say, hey, what about this or that, or bring this up, because then it might mess up their schedule. And then if their schedule is messed up, they're going to have a shitty day. And it's just like, stop, dude. It's not that serious. Control fallacies, fallacy of fairness. We are often concerned about fairness, but this concern can be taken to extremes. Blaming, shoulds. This is, I should have done this, I should have done that. If I would have done this in a past life, I would be in a better place now. Emotional reasoning, fallacy of change. These are all, the fallacy of change lies in expecting other people to change as it suits us. Oh, I haven't heard that one before. That's an interesting one. Global labeling, mislabel. Always being right. Heaven's reward fallacy. Oh, I can kind of guess what that is. This distortion involves expecting that any sacrifice or self-denial will pay off. We may consider this karma and expect that karma will always immediately reward us for our good deeds. This results in feelings of bitterness when we do not receive our reward. Yeah, so that's a big one too. And essentially, yeah, any sacrifice or self-denial will pay off in the end. Sometimes it don't, bro. You got to be careful who you sacrifice to and what you're sacrificing for, because, you know, sacrificing to a bad person isn't going to pay off. So those are the cognitive distortions that they were talking about, the 15 categories listed. A big part of CBT is unraveling, figuring out what your cognitive distortion is and unraveling it. Cognitive restructuring. Once you identify the distortions you hold, you can begin to explore how those distortions took root and and why you came to believe them. This is going through in the past and analyzing from your childhood, where did this behavior start? Why did you start catastrophizing or personalizing every decision you make in life? Oh, it was because your parent was an alcoholic. That makes sense. Okay. When you discover a belief that is destructive or harmful, you can begin to challenge it. For example, if you believe that you must have a high-paying job to be a respectable person, but you're then laid off from your high-paying job, you will begin to feel bad about yourself. Instead of accepting this faulty belief that leads you to think negative thoughts about yourself, with cognitive restructuring, you could take an opportunity to think about what really makes a person respectable, a belief you may not have explicitly considered before. So that's what cognitive restructuring is questioning, why do I have this belief? Is it effective? How do I change it if necessary? Exposure and response prevention. This technique is specifically effective for those who suffer from obsessive compulsive disorder. You can practice this technique by exposing yourself to whatever it is that normally elicits a compulsive behavior, but doing your best to refrain from the behavior. You can combine journaling with this technique or use journaling to understand how this technique makes you. A lot of burps today, feeling very burpy. Interoceptive exposure. Is intended to treat panic and anxiety and involves exposure to feared bodily sensations in order to elicit the response. Doing so activates any unhelpful beliefs associated with the sensations, maintains the sensations without distraction or avoidance, and allows new learning about the sensations to take place. Ooh. Man, that last burp had some zing to it. All right. 1 second. I never went through any interoceptive exposure. I didn't have any specific panic or anxiety issues, so that wasn't something that I know a lot about. Nightmare exposure and rescripting. Nightmare exposure and rescripting are intended specifically for those suffering from nightmares. This technique is similar to interoceptive exposure in that the nightmare is elicited, which brings up their relative emotion. Once the emotion has arisen, the client and therapist work together to identify the desired emotion and develop a new image to accommodate the desired emotion. So 2 things here. I never had issues with nightmares. I'm a writer. I write scary stories. If I have a nightmare, it's like a godsend. It's like, yes, like that's an awesome fucking story idea. Thank you. And I hurry up and write it down. So I love having nightmares. But I never had an issue with them. Still 2 important things to note here. One, you can kind of see now how CBT is structured specifically to specific people. Whatever your issue is, there's going to be specific techniques that they have you do to help yourself with that issue. And 2, once the emotion has arisen, the client and therapist work together to identify the desired emotion. So that's what I was kind of talking about with my own personal CBT. Same with core beliefs. This is a very common motif you'll see in CBT. You'll identify what isn't working. Then you'll work with a therapist to identify what would be better than the thing that isn't working, whether it's the emotion you have from a nightmare, in this case, or a faulty core belief, which was in my case. Okay, number 7, play the script until the end. Okay. This technique is especially useful for those suffering from fear and anxiety. In this technique, the individual who is vulnerable to crippling fear and anxiety conducts a sort of thought experiment in which they imagine the outcome of the worst case scenario. Oh, yeah, I've done this. I've done this before. Letting this scenario play out can help the individual to recognize that even if everything he or she fears comes to pass, the outcome will still be manageable. That's a very important one. Progressive muscle relaxation. This is a familiar technique to those who practice mindfulness, similar to the body scan. Ah, the body scan. Wow, I forgot about that one. Holy shit. That brings up old memories. Definitely practice the body scan. We'll go to that maybe in a later date or maybe later in the stream. I only got about 12 minutes left, so we might not have time for that. So you can use audio guidance. There is some really good YouTube videos out for this, or simply your own mind to practice this technique. It can be especially helpful for calming nerves and soothing a busy or unfocused mind. So, they call it progressive muscle relaxation. It seems the body scan is a form of meditation, very helpful for relaxing, increasing mindfulness. Meditation is something we'll go over in another stream because meditation is very helpful. Relaxed breathing. This is similar to the box breathing. We even say it here. Another technique that will be familiar to practitioners of mindfulness. There are many ways to relax and bring regularity to your breath, including guided and unguided imagery, audio recordings, YouTube videos, and scripts. Bringing regularity and calm to your breath will allow you to approach your problems from a place of balance. There is a science behind practicing your breathing in stressful situations. There is a actual scientific reason why that helps you calm down in a bad situation. We'll be going over that in the fourth Monday of this month. So here's different types of worksheets. These would be interesting to go over. Oh, look at, they even have PDFs. I will save this web page for later Mondays further down the road. That's what I mean to say. Some CBT interventions and exercises, behavioral experiments, thought records, pleasant activity scheduling, imagery-based exposure, graded exposure. So, wow, there's so much to go through here. I don't have enough time to go through all that. There's a couple things I did want to cover at the end of the stream, so I'm going to jump to those. And this might be some good stuff. If this stream, once I maybe get a dedicated audience, it might be fun to revisit this stream, especially since now I've done it. And second time I do it, I'll be even better at doing it. Be able to run through it much quicker. Maybe, I'm going to get some advice from my girlfriend, because as of right now, she's probably the only one watching this. She'll be able to tell me you spent too much time on all those damn statistics, whatever it is that I did wrong, I'll get it from her and then be able to switch up for tomorrow's stream, get a little bit better. And the next time I revisit cognitive behavioral therapy, maybe I'll be a little bit better at it and we can go over these different types of experiments. But for now, I'm probably going to cut the stream off here in 10 minutes. That hits the 2-hour mark. What I wanted to go over in the last 10 minutes was why you need to do it with a therapist. So this is we're going to be talking a little bit about this. Let me fill you in on some things. I want you to know if a person finds this video on YouTube, or if there is watching, I don't have my Twitch up because I don't want to see if people are watching or not. But if there is somebody watching this, or if they watch the VOD, or if they find this on YouTube, because this will be on my Cool Beans Hot Stuff channel on YouTube, what I want to say to a person who sees this is, one, you might be tempted to think, well, this all sounds good and well, and I'm down. Tony, you convinced me. You're a fucking salesman for this shit. I'm going to jump on CBT. Let's do this. At home in my spare time by myself. Don't do that. When you first at least get into it, you really need to do it with a therapist. You need to go out, you need to shop around for a very good therapist, and you need to have somebody who knows what they're talking about to guide you through it, somebody who's aware of what all these various techniques are. Because that webpage that we just went through gave you there's, what do we have here? 1, 2, 3, 4, 5 exercises. And then that was 15. I thought I said 9 different techniques. That's a drop in the barrel, man. There's so many more techniques, so many more exercises that you can do and will find and can experiment. And you want to start this process off with somebody who is going to help you figure out what your negative thought patterns are, what those maladaptive behaviors are, because the reality is you're not going to like hearing it. When you first go in, like I said earlier in the stream, cognitive behavioral therapy is not sitting with a therapist, hearing how you're a good little boy or girl and the world's just against you and everything's going to be fine, cry on my shoulder, and I'll tell you how your drunken father or mother was an asshole. That's not what this is. This is as far as it can be from somebody telling you what you want to hear. When you first start CBT, you're going to have to come into contact with and learn to accept some very uncomfortable truths about yourself. You're going to learn how you suck. You're going to learn how your brain sucks. What are some thought processes that you're engaging in that just are not fucking helpful? And what are some maladaptive behaviors and your core beliefs? It's really tough to have your core beliefs challenged, man. It kicks you right in the fucking ass. When you realize for the first time this belief that you've had for 20, 30, even 40 years of life is not a healthy belief, is not an accurate belief, it's hard to accept. It's much easier to accept if you have a professional who is calm, collective, who can take your anger, your screams, your kicks, and your bitching and moaning about your inability to accept this truth, and they can very politely and calmly explain to you why this is the case and why you're wrong. We've just gone over this for the sake of how can CBT help you, and it is about helping you. You don't go to CBT to help other people. You go through it to help you. The likelihood is, though, that if you need CBT because you are engaging in behaviors that are negatively affecting your life, the reality is you're probably negatively affecting other people's lives too. If you have a girlfriend, a boyfriend, little brothers and sisters, mom and dad, they're going to be friends. They're going to be affected by your maladaptive behaviors too. And so you're going to have to accept and learn. In some cases, it's going to be the first time you've heard in your life, in some cases, what your negative behaviors are and how badly they have fucked up life for the people around you. And that's hard, dude. That's really hard to take, man. That can be soul crushing for a lot of people. A lot of us just aren't prepared to hear how we fucked up other people's lives, so do this with a therapist. Go out. I have a disclaimer about therapists. The disclaimer about therapists is you need to find a good therapist. A therapist is just like anything else in the world, man. Like a mechanic, like a fucking pool boy. I don't give a shit, whatever, anything else. You need to shop around for it. Anybody who's providing you a service in this world, think of it like buying a new car. When you go to buy a new car, most logical people, you know what? When you go to find a new apartment, my cutie pie is looking for an apartment right now. When you go to shop around for a new apartment, logical people do not just grab the first apartment they see. That is a recipe for disaster. You shop around, you go on Zillow, whatever, finds your top 15, 20 apartments that you absolutely fucking love. And then you go visit them, you talk to the people there, you see the neighborhoods, you see, okay, this has a store next to it. There's this, my favorite shopping's over here. Ooh, it's right next to my favorite restaurant. I love the atmosphere of this neighborhood. There isn't cars getting fucking jacked in this neighborhood. There isn't, a fucking gang fucking street over there, whatever it is. You go check these places out, and then you narrow it down so you find the one that you love best, that is the most practical for you in your circumstance, and has the most about it that you love, that is going to give you the best quality of life. That's how you should shop for a car, any major purchase in your life. And don't get it twisted. A therapist is one of the biggest purchases you'll ever make in your life. Yes, it's monetarily expensive. Financially, it's a big purchase. But more than that, this is an investment in yourself. Think of therapy, any type of therapy or personal growth, facing your fears, anything that you're doing to grow as a person. It is an investment in yourself. It is one of the most important investments you make. You should always consider it expensive purchase. It's always an expensive purchase. So you need to put thought into it. You need to put serious thought into it. And when you go to find a therapist, you need to go see multiple therapists. Just like you would with a apartment, you need to go visit multiple therapists. You need to get a list of all the therapists in your area, how much they cost. Make sure that they specifically do cognitive behavioral therapy. There's some therapists that'll only work with men, some therapists that only work with women, some therapists that specialize in couples, some therapists that specialize in LGBTQ issues. You need to go out and find therapists that you know will work with you, and therapists that are within your price range, therapists that are close to you. This is important thing when you're talking about a gym. I did this with my gym, my MMA gym, and therapists. Any, job even too, you want to find places that are close to you, because you're always going to have, especially when therapy gets rough, you're going to therapy just like going to MMA. It's very comparable to going to MMA, actually. Going to cognitive behavioral therapy, it's very comparable to what it's like doing MMA at first, because for those first few months that you're doing it, you are just going and getting your ass kicked. That's it. That's what you're doing. You're going to therapy and you're going to find out how you suck today. What's wrong with you? What the fuck is in your head that isn't working? And that's hard to, it's the mental equivalent of going to a gym and wrestling with a 230-pound D1 wrestler, having him drop you on your fucking neck 5 times, crank your fucking head till your fucking shit's all fucking sore. It's getting your ass kicked. It's the mental version of getting your ass kicked. So you're going to have moments in those first few months, first year, that you're at an MMA gym or that you're at you're going through therapy, where therapy is today, and you're like, dude, I don't think I can do this. I don't think I can go get my ass kicked today. And one saving grace, one thing that's going to keep you consistent, because none of this works without consistency. MMA does not work. You're never going to become good at wrestling without consistency. You're never going to lose weight without consistency in the gym. You're never going to get better without consistency going to therapy. So you have to stay consistent. And those days when you feel like not doing it are the days that you have to do it. Okay. Not when you're sick. Like if, you're sick, you got a throat thing, you're all fucked up. Yeah, you should probably stay home and not get other people sick, right? Get healthy. But days where you just think, I don't know if I can do it today, those are the days that it's the most important to do it. And the only way you need to, I call it leveraging yourself for success. You need to leverage yourself for success, which means you need to leverage as many aspects of your life as you can to ensure success, to make success as easy of a prospect as it can be. Okay. So in this case, an example of that would be find a therapist that's close to you. Find an MMA gym that's right down the street. Find a gym that you can walk to. So on those days where you feel like, man, I don't know if I can do it, you tell yourself, you know what? I don't have to do it. All I have to do is go there. That's all I have to do. I'm just going to drive to the parking lot and sit in my truck. That's all I'm going to do. And you get there, and if it's really tough, which sometimes it can be really tough, you might get to the point where it's like, you know what, I did it. I'm still don't know if I can go in today. And you might drive back home. A lot of times, though, you're going to get to that parking lot at the gym, the MMA gym, your therapist, and you're going to be like, you know what, I'm here. I might as well fucking do this. Therapists will also charge you too. They're going to charge you the $140 for the session, whether you do it or not. So that kind of helps. But getting a therapist that's close to you is leveraging you towards success. It's making it easier for you to show up to something that it sucks to do. So make it easy on yourself. Pick a therapist that's close to you. Pick a therapist that you can actually afford. And then make a list of these therapists. Therapists, just like mostly anything else, like gyms, MMA gyms, you can go there, request 1 day for free just to test the facility out, test the therapist out. They'll give you a free consultation. Go in there, do the free consultation, and pick the therapist that you vibe with, okay? You have to do that. Pick the therapist that genuinely feels like they give a fuck about you, because there's a lot of, again, therapists are just like mechanics. Some mechanics, they fucking love being mechanics, man. They fucking live and breathe that shit. They would be depressed if they couldn't be mechanics, man. They wake up in the morning and they're like, I'm so fucking excited to work on this motherfucker's car. They're stoked. Some mechanics are just doing it for the money. They're like, yeah, I'm good at it, which is good. I'm a good mechanic, but I'm here for the money. I don't give a shit about it. If I could do something else and make more money, I fucking would, but I'm doing it for the money. Other mechanics hate their fucking job. They are only here because they found their way into it, or it's just something that they do. It's something that they're only doing in the meantime right now until they can find something better. It's a stepping stone, but they fucking hate being mechanics. And you know what? Out of those 3 people, who would you want working on your car? The one who loves being a mechanic. Obviously, you want that fucking guy to work on your car. The guy who loves his job is going to get good at his job. And that's the person you want doing that job. Okay. Now, we're not talking about your fucking car, bro. You might love your car, and that's great. Good for your fucking car. We're talking about your mind, your fucking brain, son. This thing is way more important than whatever car you drive. So which one of those 3 people do you want working on your brain? The person who loves it. You want to find a therapist that loves their job. You want to find a therapist that understands your specific set of issues and is willing to help you, is compassionate towards your specific issues. Because that's another thing. Look, people might not like to hear it, but this is a very real thing that happened. You can look it up, and, maybe we'll look it up one day as a part of Mental Health Mondays. This would be a good topic to cover. Bad therapists, although I think that might freak a lot of people out, but it is worth knowing. Short story, there's a therapist that lost her job. I think this was 2021. She was a radical feminist who had a series of male patients that she wasn't helping, that she had convinced over several months or even years of these men going to her that they were predators. They were they were predators, they were oppressors, they were very bad people. And she had convinced these men who had mental issues already, she had made them worse by convincing them that they were bad people. And a couple of them ended up killing themselves, ended up blowing their fucking brains out because of this bitch. And she lost her job. Okay. You can go look it up to see if that's a true story. You're going to find it is. And you know what? I would imagine if you look it up, you're going to find that thing has happened to both men and women, to everybody multiple times. There's multiple scenarios of therapists who have said horrible things. There was the therapist, this was a big deal there for a while in 2019. They had some progressive therapist go speak at Harvard, and she was talking about how she's like, yeah, when I get white people that come into my therapy and start complaining about their problems, I always think to myself, why don't they just blow their brains out? Okay. And this was a therapist that said this on a stage at Harvard. Like, she was making a joke about it, how she wishes her white clients would just blow their brains out because they're white people. And she was a white person too, by the way, for anybody who wants to turn this into a whole, black racism. No, she was a white person. Okay. So just the point of the story is there's people out there, therapists have biases and prejudices. They can be just as fucking racist as anybody else can. Okay. You need to go out there and find a therapist that you feel comfortable with. Ask them about how they feel about specific ideologies. I mean it, seriously. What's your religion? What's your political affiliation? No, that matters to me because, unfortunately, we live in a day and age where there's groups of people out there for everybody. It doesn't matter if you're LGBTQ. There's people out there that don't want to help you out. Okay. You do not want to find yourself in the office of a therapist who doesn't like LGBTQ. You want to find yourself in the office of a therapist who, one, cares about LGBTQ people, two, wants to help them, is passionate about helping LGBTQ people, and three, understands the specific problems and perspectives of being an LGBTQ person. So it doesn't matter who you are. There is a group of people out there that does not like you. Again, if you want to look up therapists that have screwed over LGBTQ patients, I guarantee you it's out there. Therapists that have said horrible things about black people, I guarantee you it's out there. It doesn't matter who you are. There's a group of people out there that don't like you, and therapists have biases and prejudices. So do the legwork. I'm very serious. Do the legwork to make sure your therapist connects with you as a person, loves their job, is passionate about helping you, and is passionate about helping you specifically, and people like you, whatever that demographic might be. Okay. And then go to that therapist and at least do CBT with them. Let them guide you for at least a good solid, give it a year, as long as you can afford to give it. You don't have to go every single week. When I first started, I didn't really have the money to. It was just so important to me that I felt like I needed to do it. And so I only went once a month for about the first 4 or 5 months, about 6 months. And then got to a point where I was like, oh, you know what? I can now afford to do it once a week. And I did it once a week. At the tail end of it, I think the last 2 or 3 months, I was doing it twice a week because I knew that I was probably going to have to quit here in the short term. So, do it as much as you can, stay consistent, but do it with a therapist. That's the big thing I want to tell you is do it with a therapist and take the process of finding a therapist very seriously. Okay. And yeah, so that's that. That's actually all I had on it. Let's see, what else do I have on the note card? That's it. We're done. Wow, I got through the note card, and we're 6 minutes over 2 hours. 6 minutes over 2 hours. So did it first stream. Boom. It was a success, cutie pie. I think I did a good job. Thank you for watching too. Beautiful. I appreciate you supporting me on this stream and texting me when I had technical issues. You're so sweet. Okay, and to everybody else who isn't watching this or might watch this at a later date, thanks for watching the stream. I hope you learned something new. I hope you tune in for future streams, because this is what we're going to be doing every single stream. We're not going to be doing mental health every stream. That's only on Mondays. Tomorrow is Tuesday. That is Terrifying Tuesdays. So what do we got for tomorrow? Tomorrow we'll be meeting at the same time, 7 p.m. for 2 hours. And we can close all this for Terrifying Tuesdays, where I go over scary stories, macabre history, any interesting stuff happening in the world. And tomorrow we'll be going over the Bretzius family and Dutch magic. So the Bretzius family, I'll give you the quick skivvy. The Bretzius family was a family of people. I believe they were in Pennsylvania. I don't know. We'll find out tomorrow. Their house was cold. They wanted to re-insulate it. They tore down a bunch of walls and found out their house was already insulated with the corpses of thousands of animals. So we're going to be going over their story, right? Fucked up, right? So we're going to be going over their story and how it relates to something called Dutch magic. And we'll spend 2 hours going over that. It'll be a fun stream. If you really enjoy the mental health aspect of my stream, that's every Monday. So tune in on Mondays at Cool Beans Hot Stuff Twitch. Let me pull up my Twitch information because I have not memorized it yet. So let me pull up the name of my channel here. Okay. This is, oh, okay. Yeah. Oh yeah. I paused that. That's right. So this is my channel name. Where is my channel name? My channel name is Cool Beans Hot Stuff. That's all one word. CBHS, all capitalized. You can remember, like, Cool Beans Hot Stuff, because that's what I made it for. Okay. And yeah, so hopefully I see you again here on some day. Anybody who watched or who watched me live, anybody who watches this further, thank you for taking the time to watch my videos. This will also be posted to the Cool Beans Hot Stuff YouTube channel, and then at a later date I will have clips playing on the Cool Beans Hot Stuff TikTok. So check those out too when they come around. I'll keep you posted on that. But to everybody else who might see this video, thank you very much. I hope you enjoyed it. I hope you learned something new. And yeah, hopefully I will see you for a live stream on Twitch one day. And tomorrow I will see you all again at 7 p.m. All right. Thank you so much. Bye, everybody.